Most people think kidney disease is loud. They imagine a sharp pain in their lower back, a sudden change in how often they urinate, or some other clear warning sign. But biologically, our kidneys just don't work that way. In fact, kidney disease is one of the quietest, most subtle processes in the entire human body. A huge number of people lose a significant portion of their kidney function without any pain, without any noticeable symptoms, and without even knowing that anything is wrong at all. And by the time the problems are finally detected, the damage is often severe and far advanced. To understand why this happens, you need to understand what your kidneys are actually designed to do. See, the kidneys are not warning organs. They are filtering organs. Every single minute of every single day, they are silently filtering your blood, removing waste products, regulating your body's fluids, balancing electrolytes, and helping to control your blood pressure. They do this continuously and quietly. And here's the crucial part: they are designed with enormous redundancy. You don't need 100% kidney function to survive. You don't even need 50%. This built-in redundancy is protective, but it's also what makes kidney disease so invisible in its early stages. When some of the filtering units in your kidneys get damaged, the remaining healthy ones simply work harder to pick up the slack. This is a process called nephron compensation. Each of your kidneys contains about 1 million tiny filtering structures called nephrons. When some of these nephrons are lost due to damage, the ones that are left increase their workload to make up for the loss. As a result, filtration continues, your blood tests stay normal, and you feel perfectly fine. But this isn't healing, it's compensation. And compensation is incredibly good at hiding damage. This is precisely why kidney disease is often called a silent condition. It's not because nothing is happening inside your body. It's because your kidneys are so good at adapting quietly. It's the same way your liver and your heart can adapt to stress. The pattern repeats itself across these vital organs. When pressure increases in the system, the kidneys respond. For example, high blood pressure forces more blood through the nephrons, making them filter harder. At first, this extra effort maintains balance in the body. But over time, this increased pressure starts to damage the delicate filtering structures. Tiny leaks can appear, inflammation can develop, and scarring can begin to form. Still, there's no pain. Your kidneys don't have the kind of pain receptors that are designed to signal this type of early, microscopic damage. Pain usually only appears when there's significant swelling, a blockage, or a major infection. Chronic kidney disease doesn't cause any of these things in its early phase, so the body remains silent. This silence is then reinforced by the way we typically test for kidney function. Most routine blood tests measure a waste product called creatinine, and use it to calculate something called an estimated filtration rate, or eGFR. But these markers are late indicators. They only start to change after a significant loss of overall kidney capacity has already occurred. Because the remaining healthy nephrons are compensating so effectively, these numbers often stay within the acceptable range for a long time. Doctors might reassure their patients that everything is fine, and since the patients feel fine, nobody suspects a thing. All the while, the damage continues. This creates a dangerous illusion of safety. From the outside, everything appears stable. But on the inside, the kidneys are under ever-increasing strain. This is why kidney disease and heart disease so often go hand in hand. It's not a coincidence. It's a result of shared pressure. High blood pressure damages both of these organs. The heart adapts by thickening its walls, and the kidneys adapt by filtering harder, a process called hyperfiltration. In the short term, both organs survive, but both are accumulating silent damage. and both will eventually fail when their reserve capacity is completely exhausted. Modern life, unfortunately, accelerates this process. Things like chronic dehydration, a diet high in sodium, persistent stress, and poor sleep all subtly increase the pressure on our kidneys. It's not enough to cause immediate symptoms, but it's enough to force the kidneys into that state of constant adaptation. Again, the kidneys respond logically. They filter harder, they change how they handle sodium, and they adjust hormone levels, all in an effort to maintain balance. And balance is preserved, but health is not. This is a really important distinction to make. Homeostasis, or the body's ability to maintain a stable internal environment, does not equal health. The body can maintain balance while slowly losing its resilience. Your kidneys are masters of this trade-off. They will sacrifice their own long-term integrity to maintain short-term stability for the whole body, and they do it all quietly. This is why a kidney disease diagnosis so often feels like a complete surprise. People are shocked. The first thing they often say is, "But I had no symptoms." That statement is accurate, but it's also misleading. The absence of symptoms doesn't mean an absence of damage. It just means the kidneys were still successfully compensating. Until, one day, they couldn't anymore. And once kidney function drops below a certain critical threshold, everything starts to accelerate. Waste products accumulate in the blood, fluid balance shifts, and blood pressure rises even further. This creates a vicious cycle. The worsening kidney damage puts more strain on the heart, and the increased heart strain, in turn, worsens the kidney damage. This destructive feedback loop is known as the cardiorenal loop, and it very often begins silently, long before any diagnosis is made. This is why waiting for symptoms to appear is so dangerous. Kidney disease isn't designed to hurt you early on. It's designed to adapt. Understanding this fundamental principle completely changes how we should approach kidney health. It shifts the focus away from a fear of symptoms and toward an awareness of our internal environment. We need to ask, what pressures are my kidneys responding to every single day? What forces are increasing their filtration demand? And what is preventing them from having a chance to recover? Because, just like your heart and your liver, your kidneys also need periods of recovery. They need periods of low pressure, low inflammation, adequate hydration, and restful sleep. Without these essential recovery periods, the state of compensation becomes chronic, and chronic compensation eventually becomes disease. In part 2 of this series, we will explore some of the most common forces in modern life that quietly damage the kidneys. We won't be talking about dramatic toxins or rare conditions, but rather the everyday patterns and habits that feel completely normal. Then, in part 3, we will explain why kidney disease is so often detected late, why opportunities for early intervention are missed, and how understanding this process of compensation can completely change our approach to prevention. Because once you recognize the pattern of silent adaptation, you stop asking, "Why didn't I feel anything?" And you start asking a much more powerful question, "What has my body been compensating for all along?" Thanks for watching, and be sure to subscribe for the next part of this important series.